Good morning. Today we're going to be conducting our nursing theorist presentation on Jane Watson. My name is Carlos.
My name's Evan.
Victoria.
And Emma.
And so some of the historical events that may have affected Jane Watson is that she was born during World War II. She lived through the civil rights movement in the 1960s, as well as she lived through the Vietnam War. She lived through the HIV epidemic, the Gulf War, and the 9/11 attack.
Okay, so the society's beliefs on health and illness at this time. Many were using alternative medicine instead of modern medicine due to its compatibility with their values and beliefs as regards to nature and significance of health and illness. Alternative medicine is gentle and typically does not cause side effects. People frequently resist obtaining medical attention even when it is required. Superstition, myths, and religion were the primary explanations for the incidence of disease. Such is the case of a mental illness, that it was a product of supernatural forces and demonic possession, and this often led to primitive treatment practices.
So some of the social and economic norms of the era were, in the 1960s, women were primarily homemakers, which meant that they were in their early 20s trying to start a family, getting married, and staying at home, being the primary homemakers of the family. And also in the 60s, the feminist movement started to kick off, which allowed women to be integrated into the workforce. And throughout the 1980s, there were economic recessions, which, like any job, nursing is prone to be affected by those recessions.
Okay, the roles of women at this time. Women advanced their education, gained more knowledge, and got a boost in wages. Women were getting respect in the workplace and were given professional treatment at work. Political influence among women increased. Women's rights movement achieved great progress in the 1970s.
So then all of these things eventually influenced her main contribution to nursing, which was her philosophy and science of caring. Her main goal of this theory was to distinguish the difference between nursing science and medical science, and the most memorative factor about it are the 10 curative factors. The first three of these being forming humanistic, altruistic value systems, instilling faith and hope, and cultivating a sensitivity to self and others. Jane Watson described these three as being the foundation of caring, and then the other 7 factors were kind of built off of this. She was also a distinguished professor and eventually dean of the College of Nursing at University of Colorado, and she's the founder of the Watson Caring Science Institute, which is a nonprofit organization that is just meant to advance her caring science theories. She won the American Academy of Nursing's Living Legend Award in 2013, which is the AAN's highest honor. Other notable things about her: she's earned over 10 honorary doctorate degrees, written over 20 books on her theories, and her teachings are used all over the world. In the clinical setting, her theories have been found to improve patient care and decrease staff burnout. Then we have our pop culture reference. There we go. This is just a TikTok about Jane Watson. At the beginning, it just says, searching for a nursing theorist that focuses on caring, and then talks about her being one of those. And this just shows how she's one of the most notable nursing theorists to talk about caring, and that it really was the main focus of what she wanted people to hear. So, thank you for your time.
Thank you.